Sure. Io ti sto su mobile su banzata. إزاي بس وش اليوم؟ Stand by man big. My name is Dr. Ghulam Farooq. I'm an adult cardiologist. We are here in Pakistan. My qualification is a FCPS cardiologist trained from National Institute of Cardiovascular Diseases, Pakistan, Karachi, and post FCPS interventional cardiology trained for 28 months at NICVD, Karachi. Today, the date is 19 November 2020. This is the echocardiogram of a male patient, age is 26. The history of the patient is very, very interested. Just the orthopnea for the last 3 months, and ex-smoker, in non-alcoholic and non-diabetic. And the rest of the history of the patient is Muslim, is living at a height of 7,000 feet from the sea level. Because we are here in district Dir, and Dir is the district of a province called Khyber Pakhtunkhwa, and Khyber Pakhtunkhwa is the province of Pakistan. The altitude of this area from the sea level is 7,000 feet. There is no trauma to the back, because the patient also complaining pain in the back and is unable to stand even for prayer namaz. And there is also some gastric problem, and the patient received a lot of medication for cardiac and also for the back pain and joints pain. No history of alcohol, no history of steroid, non-diabetic patient, and no previous history, just pain in the back 2 years, in pain in the limbs 3 months, and nausea and non-diabetic. Why here is I'm asking, what is the finding on the echocardiography? Anyone can comments, because there is no previous history of valvular heart disease and no history of myocardial infarction, and why the heart is looking dilated with severe LV, global systolic dysfunction, along with moderate to severe MR. Anyone can comments? And this is the X-ray of the patient. Look at this is the chest X-ray, and these are the bones of the patient. Look at this. These are the femur, and this is the tibia. Look at these bones. Just look at the vertebrae. Because this is looking severe osteopenia. So I'm cardiologist because I think for me this is most probably this post-viral myocarditis because actually the human being is a grass cutter, and when that was 1821, when someone is given butter to the rats, the vision of the rats is improved, along with the rats become healthy. When they heated the butter, the rats become blind, but they remain healthy. They given the name to that substance, this is D. Then another scientist work on that, and they use sunlight. They given the name as sunshine vitamin. Then another, when used by the people in the world, when they improve, they given the name as smart vitamin. And then in the I think in 2005 given the name is hormone D because it is sequesteroid. There were special diet from the guard, which was Mansalwa, then diffused by some ethnicity people, so the guard banned the diet. And then the guard given instruction to eat all the halal thing except the meat of the fork as a whole, and those things which is without Allah Akbar and will be not use flowing blood. Then some ethnicity people refuse and they insist to eat the fork. Then the God ban fads in Torah. Then when the Quran and as in Surah Anam, verses number 146, وللذين هادوا هرمنا كل ذي ظفر ومن البكر والغنم حرمنا عليهم شهوما وإلا ما حملت ظهورهما أو الهوايا. You people can eat the fats which is attached to the bones and tails. And there is very special story in Quran. There was young boys who were the name of Aswabika. They were sleeping in a cave for more than 309 years, as in Quran, Surah Kaf. When they were changed to the right, there was diversion of sunlight rays from the skin of Aswabika. There was no direct sunlight on the exposed skin on Aswabika because they were sleeping for more than 309 years. And as in a different tafsir of Quran, the mouth of the cave was to the north and one to the south. At the west, there was more chance 309 years if direct sunlight hitting the skin of anyone can burn. And when someone walking, the male in Muslim should be exposed the skin. If that skin is not exposed, that will be not go to Jannah. So actually, we all human being need a balanced diet, because as everyone know, when the Finson used phototherapy for the lupus vulgaris, then they awarded this is also is very interesting. This is heliotherapy that was 1861 when the phototherapy used by the Greece people. They didn't call the worship of the sun. This is a great God for us. This was the Finson who awarded the Nobel Prize because he treated the lupus vulgaris with just phototherapy. So I'm cardiologist. Here is when actually the human being is a grass cutter. I will become to the diagnosis of this young male because when the human any mothers in the world who are born with hormone deficient, there is 60% chance to be delivered in hospital. Even the baby born at home or at hospital, the mother milk is deficient with magnesium in bone with hormone. So that should be loaded with 2 lakhs international bone with hormone. And then at the age of 5 months, the lower limb skin should be exposed 5 inch to direct sunlight for up to 15 months, and after 15 months 10 inch every day up to 3 years, and after 3 years the whole body should be exposed to sunlight for 15 minutes. But in Islam, even in being a human being, the skin of female or male should not be exposed in the public places. So for the female, anywhere, if the Muslim and non-Muslim, need to expose the skin of the limbs and arms at home to direct sunlight. So actually that the ultraviolet B rays in the skin, ultraviolet B rays in the sunlight, because the ultraviolet rays 3 types, A, B, C. A should be divided, the frequencies 400, and B frequencies 293, 15, and C rays is controversial. Some scientists now say that rays is absorbed by cornea or ozone layer. So when the ultraviolet B rays hit the skin, there is in the epidermis there are 2 layers, basal layer and spongiosum. There is 7-dihydrocholesterol. 7-dihydrocholesterol. When the exposed skin hit by the sunlight, that converted to pre-vitamin D3 in the skin, and from the skin they come to the liver, and there is first hydroxylation, and then in the kidney second hydroxylation, and now the active bone vitamin come to the small intestine. Now I'm a cardiologist. If the sunlight not direct hit the skin, the 7-dihydrocholesterol, just look at this point. If no use of ultraviolet barriers on skin, this is converted to cholesterol, and they lead to hyperlipidemia, which is the number 1 cause of death in the world, is heart attack, CVPVD, carotid artery disease. So when they 7-dihydrocholesterol converted by the ultraviolet B rays, they come to the small intestine. And the small intestine, they function 3. They absorb the calcium for the bones and teeth, and the magnesium also absorb the magnesium. So the magnesium deficiency lead to a lot of problem in the world, just increased salivation and autism in the babies, and in the adult group, they lead to sweating and burning soles, and depressions and anxiety and panic disorders and bedness in the mouth, and the muscle become weakness, just like hernia, myocarditis, and the vestibular nerve become weak, so they lead to vertigo, and the cochlear nerve become weak, they lead to some deafness early, and palpitations and phobias and whitening and premature hair fall and sleep problems and different types of headache and bad smell in the mouth and sweating and burning soles and palms, and there is and someone can lose self-confidence, and this is very interesting in the presence of hypovitaminosis D. The zinc is not properly used. This is very interesting. So the immune system become depressed. So when the immune system become depressed, we are facing different types of infections like tuberculosis and corona and other viral infections, and like also throat infections as the streptococcus head that and they lead to rheumatic disease and different types of allergies, and there is the auto stimulation of the autoimmune system. So they lead to diabetes, mellitus, psoriasis, and some colon cancer, prostate cancer, ovarian cancer. So we come to the other limbs. When the bone vitamin is decreased, the parathyroid hormone is increased, because everyone need calcium for the bones and teeth and for the rest of the body. So this parathyroid hormone now increases secondary to hypovitaminosis D, which is called secondary hyperparathyroidism, and this parathyroid hormone is called thief of the bones, or the rat which is eating the roots of the tree. So now they remove calcium from the bones and lead to rickets, osteomalacia, osteoporosis, joint pain, back pains, and teeth problems, and short stature and deafness. Because the ossicle becomes soft, so there is early deafness. And as everyone know, in the presence of increased hypoparathyroid hormone, the renal tubules calcium excretion increases, lead to renal stone. So everyone know when someone is normal, the bone density start to decrease at age of 16. 1% bone density is loss of the male and 12% in the female. And if someone reaches the age of 30 years, the bone density loss 12% in the male and 26% in the female. And as in postmenopausal women, when the estrogen is there is enough estrogen postmenopausal osteoporosis, and I have noted too much in Pakistan that people using steroid for different types of body pain or joints pain or allergy. When the bone vitamin is increased, one should be go steroids because the steroid is called enemy of the bone. And other than the thing which is damaging the bone, other than parathyroid hormone and steroid, that is PPI, and Ly6, furosemide, lenoxine also, and some because the proton pump inhibitor making the media in the intestine not acidic, because the calcium absorption good when the media is acidic. So we come to the history, because if someone listening this video, okay, why the cardiologist treating the bone problems? So my open challenge to whole of the world, कि any patient in the world which is suffering of cardiovascular diseases and diabetes mellitus, uh, before pain in the body, joints pain, full body pain, fatigue, my open challenge to any scientist in the world. So my objective here is just there's yes, I accept the health problems which is related to aging process and some chromosomal disorder and genetic disorder and maybe some congenital diseases in every system. But my objective and my target is why we suffering of health problems which is occurring due to not using direct sunlight on the skin. This is my main objective. And as if we think the sun is rising from the east and go to the west, but the sun never come back to the east. Yes, one day this sun will be arise from the west, and the sun will be go to the west, and there will be the end of this world. So before ending of this world, we should be try to aware the people to use sunlight on the skin with no diet restrictions, because actually the human beings is a grass cutter, and these as if we go back to that more than 500 years back, there were three health problems, that was polio and rickets and tuberculosis, which were labeled darkness diseases. Now the health problems are due to not using direct sunlight on the skin in summer is more than 163. So let's see, actually my name is this, so the conclusion is this, to terminate, prevent and treat unlimited health problems just by using sunlight, ultraviolet B rays on skin in summer at least 60 minutes and 2 days, especially in Saturday and Sunday, especially in midday time in Asia. My name is as this, so safe use of sunlight in summer on skin with no diet restrictions. So why we don't know why we suffering of corona, why there is different cardiovascular disease in different countries. We are human beings. So now we come to the story of this young boy. So when we tested the whole labor, just just this is 4,000 Pakistani, which is maybe just 200, less than $200 here we charge this patient. The hemoglobin is 14.8 and the blood sugar is this, and the renal status is normal, lipid profile is this, cholesterol LDL urine. The renal status normal, uric acid at this age, and H. pylori reactive. Here in Pakistan, 90% people are H. pylori reactive. And then look at the level of D. What a critical bone vitamin deficiency in a sunny country like Pakistan. They should not be less than 60. But this is very, very interesting because I am going to nature because the human being is a grass cutter. This is very, very interesting. If someone using any supplement of bone vitamin in any form and they're using direct sunlight on the skin, they lead to toxicity. So no one know the answer of this. If someone using sunlight direct on exposed skin along with supplement, they lead to bone vitamin toxicity and they lead to hypercalcemia, and the consequences is rupture in the brain and renal shutdown. The God know better than human beings. But so, anyhow, so for me, the diagnosis of this young boy is premature osteopenia, secondary to age, and the second cause is critical bone sunshine bone vitamin deficiency. This deficiency is because not using 1,000 to 5,000 units of bone vitamin daily in diet, and not the second cause of critical bone vitamin deficiency, not use direct sunlight, ultraviolet B rays on skin, on exposed skin in summer. So when the bone vitamin is decreased, the parathyroid hormone increase, they remove calcium, removing calcium from the bone, so the bones becomes weak and fractures, pain, back, vertebrae become weak, femur joints become weak, teeth problems, decrease hearing, and generalized by body aches. Because my patient has history of two teeth missing, one is spontaneous fall and the second is extraction with some dentist. So the second is magnesium is decreased, so muscle weakness, so this myocardium inshallah will be improved, and the nerve weakness, so sweating, depressions, palpitation, different as mentioned. We look at this, and the zinc properly not used in the presence of hypovitaminosis D, so the immune system become depressed and they lead to post-viral myocarditis. So my conclusion is this. So inshallah, we have now my regime is this. We have advised 14 lakhs units of bone vitamin. We should be loaded with 6 lakhs straight, and then the 8 lakhs should be used. The total should be used in 5 days. And this for the H. pylori regime. And this is the regime. Here is now winter, so this patient should be continue 2 lakhs bone vitamin every 20 days, along with 800 units along with calcium every day, and the bed rest 3 to 6 months. And for the cardiac problems, captopril along with spironolactone and titration dose along with furosemide and carvedilol along with this dose. Inshallah, I hope this patient will be improved, because the viral myocarditis, everyone know the 50% people dying within 2 months, 2 weeks, and the 50% people are recover within 6 months, and the rest of the group 50% stable with medication and 50% no CRTD. So this patient is also have atrial fibrillation, because this is very, very clear, because the severe bone vitamin deficiency lead to new onset atrial fibrillation in a young age group. So any question, any suggestion should be asked. Anyone in the world should be appreciated, but we should be with evidence from the Quran, from the Hadith, and also from the scientists, because the great scientist in the world was Muhammad Sallallahu Alaihi Wasallam, and the great book in the world is Quran, because in Quran is the book which is all everything is in Quran, the past, future, and future, present, and in the past. But we don't know, we don't think on hadith why the skin lower limbs in the male one third should be exposed to, because there may be other benefits, but this is very different. This is 100% true. That skin when hit by the rays, that 7 dihydrocholesterol should be converted to cholecalciferol. In the Quran, not ban any fats, and there was no direct sunlight on the skin of Aswabika because they were sleeping. And the human being is called grass cutter. And the grass, as everyone knows, the grass growing in summer, not in the winter. And when someone cutting the grass, that is most of the time in the daytime. So I think more than 84% people are prematurely dying due to not using direct sunlight on the skin. So there is health problem which can be decreased because the health problem, especially cardiovascular disease, is increasing at the crescendo, not at the decrescendo. As we know, the top cardiac health problem in the world is cardiovascular and osteoporosis. But for me, the top health problem in the world is body pains because in young group, and the second is cardiovascular health problems. Anyhow, we have did this echo. There is dilated cardiomyopathy. The EF is just 10 to 15% with moderate to severe MRNTR with no LV or LA clot. Second, due to flu, yani fus mayo cardiomyopathy, because this is very obvious. As everyone know, even my patient is not at H influenza vaccine, my patient is not on bone vitamin, and so that the bones, and so we should be, and part the cardiologist should be first thing part the tires, then the back, then the top. We should be not first thing for the engine, we should be first thing for the tires, because for a good car to run need two things very important: good tires along with good engines. Okay, thank you. Any question should be appreciated. Again, thanks for the hearing, and inshallah I will be present this case everywhere. We should be not in this world. Let's see what the other scientists in the world mm, solve these problems. Why we suffering of cardiovascular diseases prematurely? Because we don't know this thing, what is the substrate in the skin which is converted to cholecalciferol when hit by the sunlight. That is cholesterol converted to cholecalciferol. Thank you too much. Assalamu alaikum.